You will learn about acute respiratory distress syndrome. It is also known as ARDS, ARDS. Acute respiratory distress syndrome is a non-cardiogenic pulmonary edema. It is a clinical syndrome characterized by sudden and progressive edema, increasing bilateral infiltrates, reduced lung compliance, and hypoxemia refractory to oxygen supplementation. ARDS results from an inflammatory trigger that causes injury to the alveolar capillary membrane. People at risk for ARDS are those experiencing direct injury to the lungs, example, aspiration, smoke inhalation, or localized infection, or indirect insult to the lungs, example, shock or hematological disorders. The mortality rate of ARDS may be as high as 50% to 60%. Now you will learn about clinical manifestations of ARDS. Rapid onset of severe dyspnea, usually 12 to 48 hours after an initiating event. Labored breathing and tachypnea. Diagnostic evaluation. Based on clinical criteria, history of risk factors, acute onset of respiratory distress, bilateral pulmonary infiltrates, absence of left heart failure, and severe refractory hypoxemia. Medical management of ARDS is as follows. Identify and treat the underlying condition. Ensure early detection. Use aggressive supportive therapy treatment. Prevent infection. Provide adequate ventilation initially. As disease progresses, use positive and expiratory pressure, also known as PEEP, PEEP, positive and expiratory pressure. Monitor arterial blood gas values, pulse oximetry, and pulmonary function testing. Provide circulatory support. Treat hypovolemia carefully and avoid overload. Provide adequate fluid management. Administer intravenous solutions. Provide nutritional support 35 to 45 kilocalorie per kg daily. Pharmacologic therapy may include human recombinant interleukin 1 receptor antagonist, neutrophil inhibitors, pulmonary specific vasodilators, surfactant replacement therapy, antioxidant therapy, and corticosteroids. Corticosteroids are used late in the course of ARDS. Now, nursing management. Assessment. Monitor the patient closely because ARDS can quickly progress to a life-threatening situation. Major nursing diagnosis. Impaired gas exchange related to congestion, anxiety related to fear of death. Planning and goals. The goals of patient care may include achieving adequate spontaneous, non-labored ventilation, maintaining arterial blood gas value within normal limits for patient without ventilator assistance, and ensuring that the patient experiences minimal anxiety. Nursing interventions. Promoting adequate ventilation. Facilitate respiratory management. Position the patient to maximize respiration, oxygen, endotracheal intubation, tracheostomy, suctioning, and mechanical ventilation with sedation and paralytics as needed. Provide safety interventions related to ventilator care. Encourage rest. Encourage oral fluid intake if patient is not ventilated. Now, minimizing anxiety. Provide emotional support and reduce patient anxiety. Explain all procedures and deliver care in calm, reassuring manner. Evaluation. Expected outcomes are unlabored, spontaneous patient respirations, arterial blood gases, pulse oximetry, and pulmonary function tests within normal limits. Thank you. This is an audio about ARDS disease. Thank you and subscribe for more learning with nursing and biology.